Hi. Thank you for coming.
This is
I'm
Beth.
reading. I'm Beth. Everyone here knows me. I like that lady who talks too much. I just want to remind you, we are on YouTube and we're live. So if you have private sort of health questions you want to ask or anything like that, they are out on the web. So we will turn it off after for the questions. But just to give you an FYI, if anybody on the web can't hear us, please call the office. We will get that fixed up. Hi, I don't think you can see me. What else? Today is the last day for your basket. So if you have points, questions, etc., swing on by and see us. We can help you out. What else? If you're hanging on to any points, please give them to us. Again, today's the last day. Biometrics. If anybody hasn't done biometrics yet, you still have the opportunity to go to your doctor until May 15th. We also have one screening left in Stratum. Stratum, right? Yeah. Okay. So that is coming up shortly. And then I have a screening in Portland, Maine. If you'd like to go drive to get a lobster roll, I guess you could do that. Those are upcoming.
They're
or you
really
have,
good up there.
they're delightful. Duck fat. Not very well, but delicious. What else? Other plan information. So our dental plan has gone up very slightly. So just to let you know, single folks will go up by a quarter. So save your quarters, guys. 2-person plan increased by 45 cents. And a family plan went up by 74 cents. I know. You're going to have to maybe get one less Dunkin' a month, I guess, at that rate. I don't know. What else? Our flexible spending is going to be the same vendor. So stay tuned because the amount went up by $50. Big news. That's a federal regulation, so we don't make that one up. It's $25.50 now, correct?
Yes.
Okay. And to introduce our two guests to you today. Kim is a senior benefits consultant. That sounds so official, Kim.
Yeah.
Kim's just awesome. I didn't know that was your title. She is here from Granite Group. They're a benefits broker, so she is a great resource because she assists us in selecting all of our plans, interviewing, meeting Milan up, etc. Milan is here from Anthem. And he is going to talk to you. What are you? You're a sales and retention executive.
I can be whatever
I didn't even know this.
Whatever you-
Milan is the person I call when I have problems. That's what I know. So Milan is going to talk to you about our plan. What has changed this year? I don't know how much you've heard, but I think a lot of people are very nervous. Don't be nervous. Milan's going to explain it to you. But if you need help or you need that one-on-one kind of attention, come and see us. I'm going to click for you, right?
Sure, I thought
Okay.
you were actually talking.
Nope.
I thought I'm just here for moral
Nope.
support. I guess not.
Get talking.
Thank you, guys. I think everybody has a booklet with you today, and inside of this booklet, we really went above and beyond this year to make sure that everything you really need is going to be in this booklet. And I would recommend all of you to keep this booklet somewhere where you're going to be able to find it in about 2 or 6 months, depends how long and when you need some benefits. Because this is honestly going to explain you step by step what coverage you have, as well as any other condition care programs, wellness programs, or anything like that. There's also summary of benefits, a really detailed summary of benefits inside. Page 11, which you can take a look at it. We're going to actually look at the presentation today, but on this summary of benefits, it really lists in detail how and what is covered. So I just wanted you to know about that. Also on the back here, there's information about no-cost labs that you have already utilized, I assume many of you, as well as ambulatory surgical centers, those low copay ambulatory surgical centers. Also shows you where the no-cost labs are located, as well as ambulatory surgical centers where they're located.
Okay. You have to move over because they can't hear you on YouTube. Thank
Oh,
you very
really?
much.
Thank you.
Also, there's a flyer in the booklet that explains and shows you where urgent care and walk-in clinics are available. And I certainly would recommend any of you to spend some time and take a look at this, because the costs between emergency room utilization and urgent care utilization are drastically different for insurance companies as well as for yourself, because the copays are higher when you go to emergency rooms versus emergency rooms versus urgent care facilities. Also, the studies do show that about 85% of the people that do go to emergency rooms do not have emergency. It's just that they are not, they just don't know where to go at that point. But there are options. You probably have seen a lot more urgent cares popping left and right throughout the state, as well as walk-in clinics. Also, if you have pain, you can always call your primary care doctors. You don't have to have an appointment. You call them. These days, majority of the primary care doctors in the state are owned by facilities or hospitals, which means it's not like you only have one doctor in that office. There's usually a nurse practitioner and some other doctors. So if you call them, they can usually squeeze you in at the end of the day or in the morning, come see you, because you're gonna save money by doing that. I do not recommend going to emergency rooms unless it's an emergency. So that's that. The booklet is really good information for you to take home.
And that will also be on the Easter Seals website too, and of course Kathy and I will have some. Hey there, Kathy. But if you lose the book, please don't lose the book, but it will be online too.
It's a great resource.
With that said, we'll go into the open enrollment presentation. I think everybody knows about Anthem already. We have been with Easter Seals for many years now, and we have supported Easter Seals in many ways as much as we could and can. With that said, our network is the largest in New England, and we are the largest carrier in New Hampshire, and we're the second largest carrier nationally. With that said, why
I
don't
was gonna
you?
say, we need a symbol. Go ahead.
So there are some new stuff this year. Easter Seals has spent the last few months looking at new different plan designs that we think the majority of the membership or employees will find really good, and majority of the plan design thingies have gone better for a member. And I do want to say that Easter Seals always has been one of the pioneers in New Hampshire with wellness as well as plan designs, and you will see. What did you do?
Just keeping you on your toes, I guess. I don't know how that happened. But... Okay.
So we'll go over what's new for 2015, and we'll also discuss how to utilize the health plan, the new health plan, as well as I'll give you some tips and resources. So for July 1st, that is your new plan year. That's when the new plan year becomes or affects. I do want to let you know that your plan runs from July till June, as well as your deductible runs on that plan year. So it does not run on a calendar year. Many of you might have came from other organizations where their plans run on a calendar year basis. Easter Seals plan runs from July till June, and deductible runs on that same time period. In the next few slides, we'll explain upcoming changes as well as other goodies included in the plan. So why did Easter Seals move to this new benefit design plan? And these are the major reasons, actually. To better manage the cost of healthcare services, as all of you understand, the healthcare services are constantly increasing, and the national trend is about 5 to 6%. Our local trend here is about 9%. Unfortunately, the state of New Hampshire has such an access to other facilities, high-cost facilities in our area, that usually New England trend runs a lot higher than the national trend. Also, state of New Hampshire's population tends to be a lot older versus some other states in the West as well as Midwest. So our trends run about 9%. And that just tells you what companies have to do. They have to be creative to keep that trend in the low digits, because when you keep the trend in the low digits, then you employees do get better or same coverage at no increase. We also, when we looked at this plan design, we wanted to see and give you different choices for both your healthcare team and your out-of-pocket costs. Also, employers are moving in this direction based on better costs and quality outcomes that will benefit their employees. As important, Easter Seals is able to keep your biweekly deductions at the same level as previous years. This is the major thing when Easter Seals were looking at different plan designs. This was the number one thing they looked at. They said, we want a plan that's not going to change drastically from what we have now, but that's going to keep our employees' costs at the same level. And I'll tell you, I don't see a lot of companies, private companies out there saying that. They're saying, give me a plan that I'm not going to pay any more. I'm going to shift costs over to employee, or I'm going to increase my deductibles and co-pays to get to what I want to have on my budget.
I
think that's important to note too. I'm just gonna put a plug in for Easter seals because I too see that the majority of employers are passing those costs off to their employees through contributions. And that has not happened here at Easter seals. They've been able to keep their contributions the same for, I believe, the last 4 or 5 years. That's
And that's huge. I don't see it. Like I said, I manage major accounts for Anthem, including City of Manchester as well as school districts and hospitals. And I don't see it. So Easter Seals is certainly a pioneer in that aspect. We know that your healthcare needs are unique. That's why when we designed this plan for you, we have 2 different tiers of networks. So I do want to come and just say it's not 2 different plan designs. You still only have 1 plan design, but inside of that plan design, as you will see later in the presentation, there are different tiers. And what I mean by tiers is it's almost inside of the plan, there are 2 different benefits depending which facility, meaning hospital, you go to. So the plan design still has access to the largest New England network. It still utilizes the same network as you currently have. It's the blue HMO Blue New England network, meaning the New Hampshire, Maine, Massachusetts, Vermont, Rhode Island, and Connecticut. All Blue Cross Blue Shield providers participating in those states you have access to.
What if I have a child who goes to college outside of New England? What should I do? Or if I'm traveling?
It's a great question, Beth, and thank you for posing that
You're
question.
welcome. Yeah.
The plan only covers New England, but in the plan, if you go elsewhere or your child is attending a college in Tennessee or Maryland or Florida, you do have emergency coverage. So if your child gets an emergency and heads over to the emergency room and they treat him, that will be paid same as if your child was up here in New England. But if your child decides, I feel like getting preventive screening done while I'm at college in Maryland, unfortunately that will not be paid because your area is New England. But emergency situations are covered same as if you were here locally.
Would that include urgent care? Or should, like, if you're, like, if I'm traveling, I'm out somewhere, do I
Great
just go
question.
straight to an emergency room, or do
Yes.
I have the option?
Please do. And it's almost counterproductive because we want you to go to a urgent care while you're up here. But the system of coding, the way they bill, the system doesn't recognize the way when someone out of New England bills urgent care, the system is going to deny that claim because it's deemed not an emergency. So when you're outside, just please please go to emergency room outside of New England. Your prescription drug coverage with this new plan did not change. That's another great feature. It's staying the same as you currently have it. So your generics are 10, your brand name are 30, and non-preferred are 50. So that did not change. You still have preventive care and annual checkups and vaccination as you have today. And there's also health and wellness tools available for you to utilize as well, which I'll show you later.
Oh, this is, okay.
So
That
just
was a trick.
so some key terms, I think majority of you already understand these, but I wanted, just for those that don't get what the deductible means, copay. So deductible is the amount you pay each year before your plan starts to pay. It's pretty similar to your auto insurance. So you get in an accident, it's your fault. You have an auto insurance. Usually there's a deductible in front that you have to pay before the insurance company pays the rest. That's exactly the same way it works in your medical plan. Copay, you pay a copay when you visit your specialist or a primary care doctor. It's just a flat dollar fee. Coinsurance is after you pay your deductible. So you pay your deductible up front, then insurance is splitting the rest of the bill between you and the insurance company. So depending what coinsurance level you have. Out-of-pocket maximums, that is the most you can pay out of your own pocket in a calendar year or plan year in your case. And premium is the amount you pay bi-weekly or weekly, whatever your payroll records run on. So the new plan is called HMO Blue New England Choice. And here are some important new plan features. The one thing that you do have to do going forward, effective July 1st, is have a PCP on a file, meaning you're gonna have to assign a primary care doctor with Anthem's records. And then, if you needed to go see a specialist, you're gonna have to have a PCP or your primary care doctor refer you to go see a specialist. At this point, you do have to have on your current benefit, you do have to have a primary care doctor on a file, but you do not need that referral. So going forward, effective July 1st, if you wanted to go see a specialist, you would have to have your primary care doctor refer you.
I think it's important to note too that the majority of primary care physicians typically want to give you a referral or are doing that anyway. It may not be required currently under your plan design, but it is their natural way to do this.
It is, that statement is certainly true because state of New Hampshire, insurance-wise, is saturated with HMO products or health maintenance organizational products. So primary care doctors have been they've been doing this for years. So they are automatically doing it because they do not see, I can say that 95% of our book of business in New Hampshire sits on HMO products. And I can say the same for our competitors as well. So they're used to doing that. The new thing that this year you have, it's called annual out-of-pocket limit. This is mandated by healthcare reform. This is something new that's going to be effective July 1st. So healthcare reform mandates that there are limits on how much you can spend out of your pocket, including your deductibles, your co-insurance, your co-payments, your drug co-payments. So if, in essence, if you at some point in your plan year got up to $6,600 out of your pocket, meaning you paid your deductible, then you paid a bunch of co-payments, some co-insurance, a bunch of RX co-payments, and you got up to that point. After that point, you are not responsible for a dime, meaning you stop paying co-payments, you stop paying everything. Everything's paid by insurance company. 100%. And up to this point, you did not have that limit. So if you can imagine, if you had a deductible, you met the deductible, right? And that's fine, deductible stuff, but you still continue paying those co-payments, right? So if you had let's say you had a back surgery and you satisfied your deductible, that's great, but you now are visiting specialists, you were paying that co-payment. If you got up to that level, then all those co-payments stop. So that's for a single, that's for a family. And this is new. So this is an added value protection for you. So say. The new thing for this plan is that, like I already explained, there are two tiers inside one plan. So it's not two plans, it's one plan with two different benefits. And I know some people were confused from our previous sessions. Your plan still includes great features like preventive care is still covered 100%. It's still all participating Blue Cross Blue Shield providers in these states still participate. You still have those no-cost laboratories. And I'll say this over again. Please pay attention and utilize these because these are not costing you a dime. Has anybody gone over to Quest Diagnostics Lab 4 to get their labs? It's pretty simple. It might take a couple days longer for your doctor to get those results, but at the end, you're saving yourself a lot of money. The average cost for a blood work, just a regular blood work, is somewhere between $350 and $800. So if you went to a hospital to get that done, you would have paid your deductible. And if you go to these facilities, you don't pay anything. It's paid 100%. So make sure you continue utilizing these facilities.
And you can use those facilities as well, not just in an office visit setting, but if you're having like an outpatient surgery and anything needs to be sent out, many times they'll ask you, where do you want us to send this? And that's what you want to say. I want to send it to Quest, or I want to send it to LabCorp, or I want to send it to one of those participating.
You still have the Compass Smart Shopper program. It's going to be embedded. So does anybody know what this program is? Have you utilized it, ma'am?
Yeah, I've used it a couple times, it's great.
Did you receive the checks back?
Comes right up, goes in checks and, doesn't it? Then I haven't received
So
it, but
it's-
I have used it. For referrals. They have referred me to places that I needed to go.
Right. So this is a great
Yeah.
program designed to help you. We understand that shopping for healthcare, it's pretty difficult. It's not like when you walk in a specialist's office, their price is listed. Oh, if you have a office exam 1, this is how much it's going to cost you. Office exam 2, this is, you don't see that.
We should do that though.
Yeah,
That'd
that's
be
never-
so helpful.
You don't see that. So we designed in partnership with Compass a pilot program about 5 to 6 years ago, and it has taken off extremely well. So what it is, it's a program, and they sit over here in Bedford. So you call the number and you say, okay, my doctor wants me to have an MRI done, and they want me to have it done at Elliott Hospital. This is just an example. Anthem provides them data. So they will open their data and say, okay, if you go over to Dairy Imaging and have that MRI done, it's going to be a lot less costly for your company as well. It's going to be less costly for you. And also, if you do that, we're going to send you a reward check. And they can, some of these checks are up to, $150, even $500. So I say to people, especially those people that have met their deductibles, this program makes money for you. Because if you have met your deductible, you're going anyway, right? So you're thinking, why should I call? I have met my deductible. I'm not going to pay anything anyway. Because you can make $150 just by calling. So it's a phenomenal program.
Colonoscopies, mammograms also are covered at 100%, and then you can actually get paid for that. If you have questions, I have like a sample login too. You can come and sit with me if you want to see. You do have to call as a member, but I can look it up for you and give you an idea of what you're worth, what your colonoscopy's worth.
And you do have to call and hook up with them. You can't go to one of those providers and just say, oh, well, I went. I knew that was a provider they used. You have to call.
So is all the Compass information available online now of what procedures are that are covered?
It
what
is
facilities
absolutely,
are?
you can go online and kind of walk through the wizard online, or you can call it.
Have they expanded their services at all? 'Cause
No, there's going to be a list probably of 15 major services that are rewarded because those are the most utilized services.
Is that also listed in the booklet? Or is that
No,
just-
we haven't listed in the booklet because effective July 1st, there's going to be a new list coming out, so we haven't had the list yet. But that's a good question.
And I think that changes during the year too, so.
Sometimes.
So that's probably why it makes sense to have it
Let's
online, yeah.
Yes, sometimes it does. We'll be communicating throughout the year, just weekly or monthly memos, just sending out updates. So this is so you're probably asking yourself, and I know many of you have already seen it in your booklet. What are my deductibles and copayments by tier? So if you're utilizing tier 1, and we'll get into the facilities later, these are your copayments per service for tier 1. So you can automatically see. So if I'm going to a tier 1 hospital and tier 1 primary care doctor, going forward July 1st, I'm going to be paying $15 primary care copayment. And does anyone know what you're paying right now for primary care copayment? You're paying $25. So you're getting a better benefit effective July 1st. If I utilize tier 2 provider, I'm going to be paying $30. So I'm paying $5 extra effective July 1st if I continue or utilize tier 2. Specialist, I'm going to be paying $40. Same thing on a tier 2. So specialists are not tiered. So, and right now, under your current plan, you pay $50. So there's a savings already. And remember, in the beginning, I said your costs are staying the same. So you're getting a better benefit so far, and your costs are staying the same. I think Easter Seals hit this one on the nail. You still have the ambulatory surgical centers copayment, and what this is, and the copayment is the same between the tiers. If you wanted to have if you need to have an ambulatory surgical center or outpatient surgery, you can go to certain facilities, and they're listed on your booklet, and have that surgery done for only a copayment, instead of going to a hospital and getting that done and paying your deductible and insurance. Your PT, OT, ST, physical therapy, occupational therapy, and speech therapy, that's going to be $40, and right now you're paying $50. So that's another better benefit. Your single deductible going forward is going to be $2,000 in tier 1, and it's going to be $4,000 in tier 2. So we're saying you have a choice, and we'd like to give you a choice. If you want to have the same deductible as you currently have, then you're gonna have to make a decision to utilize tier one facilities. If you don't want to do that, and it's 100% your choice where you want to get your care done, you're gonna pay a little bit more. Your family deductible is also, it's gonna be in tier one, 4,000. In tier two, it's gonna be 8,000. So this stayed the same from last year. The good thing about it, currently, under your current plan, after you meet that $2,000 deductible, you're paying 10% for insurance. In tier one, effective July 1st, there's no co-insurance. So that's another better benefit. And your cost is staying the same. On tier two, there is co-insurance and it's 20% after deductible. Your emergency room co-payment is going to be $250, and same thing on the tier two. Urgent care co-payment is going to be $125, same thing in tier two. Also, I do want to let you know that some of the benefits, as you will see in your booklet, are not tiered. For example, we understand that in emergency situations, you cannot choose which facility you're going to go to. So we decided we're not going to tier emergency situations. So if you have an emergency, it doesn't matter which tier, which emergency room you go to, it's going to be paid at tier one. And you will see it in your booklet. I'm not going to go too crazy in details, but that's one of the benefits, that it's not tiered. So
I think just on the emergency too, and you'll see this in your booklet on page 13, there is a co-payment of $250, but there are some services that fall outside of that co-payment. For example, I believe ambulance is one of them that will fall to your deductible. It's noted here in your summary of benefits. It's just something to be aware of.
and it's the same as it's currently. Yes.
I'm looking at the family deductible.
Yes.
And let's say during the course of the year, I end up going to both tier one and T2 service providers. Am I gonna end up with a $12,000?
That's a great question, and thank you for posing that question. These deductibles cross accumulate. So if you go in the beginning, so in August, you go to tier two hospital and you get the surgery done because you wanted it, that was your choice, and you satisfied that $4,000, you have also satisfied that $2,000. So they do cross accumulate. Same thing, if you go in August, if you go to tier one and get the surgery done and you satisfy that $2,000, that's going to carry over to tier two deductible. So it's cross accumulation.
And I think it's important too, and Milan will talk about this in more detail, but at every time that you are making an interaction with the healthcare system in this program, you get to choose whether you're going into tier one or whether you're going into tier two.
You don't have to pick. You don't have to say, okay, I'm always going to be in tier one. That's the only place I'm going to go. You can mix and match and swap back and forth.
So if you are a user, and we'll show you some examples later, if you are a user where you just go to your primary care doctor for a physical, and then you have a couple specialist office visits, then you're going to come to, and in case your primary care doctor is associated with tier two, then you're going to tell yourself, is it really worth for me to find a new primary care doctor at tier one just because I'm going to pay $15 extra? It's going to be your decision. But in cases of surgeries, high radiologies, that's when it's your money. Then you start thinking, wait a second, why should I pay someone $2,000 more when I can get that same thing or similar thing done at this? So I'm going to show you which hospitals are in which tier. And before I go into which hospitals are in which tier, the way we tier the hospitals,
We're done.
I need a drink.
Yes, I was gonna say.
the way we tiered the hospital is, number one, it was based on cost. So we know how much each hospital tiers. And number two was quality. So a hospital could not have been on a tier one if their quality is not met. Same thing vice versa. So if their quality was met for tier one, but their cost was not, they could not be on that list. So in tier one, you have Alice Bath Day, Cheshire, Cottage, Elliott, Frisbee, Monadnock, Parkland, Portsmouth, Southern, Spear, St. Joseph, the Memorial, and Wentworth Douglas. So depending where you live, for example, in Stratham, the ladies over there would probably majorly utilize Wentworth Douglas or Portsmouth. Tier 2, as well, you can see which hospitals are in Tier 2.
Yeah.
That stinks because
Yeah.
regionally you only have like one choice.
That
If
is
I live in
correct.
Concord, I'm not gonna go drive to Manchester to get done.
Okay, can we have the map?
They're gonna have to if it's not
Okay.
emergency.
Depends on what it is, yeah. You
Right,
might feel
so-
differently.
I know a lot of those names do not mean things for a lot of people if they're not in an industry like I am. So I did this so you can see where hospitals are located. So people, if you live in Rockingham County, Hillsborough, Cheshire, you have an access to Tier 1. And I'm not saying that even if you're, in your case example, if you live in Concord, yes, the Concord Hospital is not in Tier 1, but if you're gonna have that procedure that's gonna cost you money, you're gonna think twice and say to yourself, maybe I will drive to Elliott and have it done at Elliott.
You could visit me closer, I do that.
There you go. And we are asking you to be, consumers of healthcare now. We're asking you to make choices the same way that you shop, today for many other items as well, or products or
We're
services.
providing you information and having you pick or choose.
So are these hospitals pretty much locked in for this plan year?
For 12 months until 2016, actually 17, they're locked in right now. But there will be movement, I would assume, once this program kicks off. And you're an actual first company that's going with this effective, because this program is brand new. It's coming on from July 1st. Us groups, and we imagine a lot of groups will shift on these programs. As groups move and hospitals realize what's going on, they will come back knocking on,
But they
hopefully.
can't shift for another year? Like,
At this point, we're saying it's 12 months, but we always reserve the rights to look at that based on the business decision.
you know, your contracts with the hospitals won't necessarily be.
Right, and we didn't negotiate any new contracts. These costs are based on their current contracts. Go ahead.
And primary care, can you just mention primary care physicians that are affiliated with those hospitals? 85% of the primary care physicians in the state of New Hampshire are hospital.
Yeah, so
I think
primary
that's an important piece to.
care doctors go with the hospital tier. So if your hospital, for example, if you go to St. Joseph Hospital and you see St. Joseph Hospital is in Tier 1, but you know your primary care doctor is associated with that hospital, they're automatically in that tier, same tier. Independent primary care doctors, they're automatically in Tier 1.
Can you give an example of who an independent primary care physician might be?
It's so difficult now these days because there's only few of them.
And we'll find that out when we select our
Correct.
PCP. We'll find
Yes.
out.
And we have developed guide how to select your PCP and also how to look at the PCP on our provider finder so you can see which tier they're in.
Move to the next one.
So this is a Tier 2 list of the hospitals. Can you shift back and forth just quickly so you see what's happening here? See how the Tier 1 versus Tier 2 automatically
I
it's
gotta
shift.
move to the south.
Exactly.
And that's with everything. Everything costs more in this area versus here. And this is where population for New Hampshire sits. Rockingham, Hillsborough, and Merrimack. This is probably, I would say, 75% of the New Hampshire population sits here. Everything up here costs more, So as you go north, you can see the shift.
Where does Stratton fit?
Dr. Hitchcock is in Tier 2.
This is probably because of cost.
So how about Blue Cross Blue Shield in Massachusetts? So depending where you live in Massachusetts, and as you can see, they have a lot more hospitals than we do in New Hampshire. We're utilizing Blue Cross Blue Shield of Massachusetts tiered product. So whichever tier their hospital falls in, that's which tier it is.
Can that list be found online?
Yes,
somewhere?
we have. So you can see this
Sorry.
is their tier 1. Look how many hospitals they have in tier 2. So shift over, and this is their tier 2. So only few hospitals in Massachusetts are in tier 2. So I also wanted to show you how about Boston hospitals, because if you go back, looking at the big list, one more. When you're looking at these, they're like, I'm not gonna go there if I live in New Hampshire. This is where I'm gonna, so shift back to Boston. So this is, if you live in New Hampshire and you're going down to Massachusetts, this is where you're going, Boston. So that's why I put the slide to show you where the major Boston hospitals are located. So Tufts Medical Center, that's in tier 1. So if you're going down to Tufts Medical Center, it's gonna be in your tier 1. If you're going to Birmingham and Whitman, it's gonna be tier 2. Dana-Farber Cancer, it's in tier 2. But then your Boston Medical Center, Beth Israel, as well, Mass General and Boston Children's is in tier 2. So this is where majority of the population from New Hampshire is going if they're going to Massachusetts. So it's broken evenly. So the question, we can even skip this.
I was
Go
gonna
back.
say, where's the little slashes? That's so upsetting.
So how about Connecticut, Vermont, Rhode Island, and Maine? So those members or those coworkers of yours that live in those states, their providers are automatically in tier 1.
Milan, can I just go
Yes.
back to the Massachusetts for a second? Do we have to, if you're using a Mass hospital or you want to look that up, do you have to go into the
Yes,
Blue
we
Cross
have-
Blue Shield
we-
Mass?
Yes,
System.
we have a guide prepared.
That's right.
It's going to be online how
That's
to
right.
look that up. It's pretty
Yes.
simple. I took screenshots and made a
That's excellent.
guide. It's pretty simple for you to look it up.
We have that. We talked about it. I'm happy to send it out.
All right, go. So now let's just get in a few examples. I don't want to bore you to death. So I said bet is utilizing services at tier 1, and this is the bet, and it's pretty similar to.
I was gonna say, this is real life, so go ahead, have at it.
So here is first in this blue, I'm showing cost of services she had. So Beth went to her primary care doctor and she had back issues. Primary care doctor billed Anthem for $150 for that visit. Then that doctor referred her to a specialist because he couldn't really figure out what was going on with Beth. So he said, I want you to go see a specialist. So Beth went to a specialist and specialist billed Anthem $400. Then specialist said to Beth, I want you to have some lab work done to just check your stuff. So that lab work cost $250. Then finally it was decided that Beth has to have a surgery, and that surgery costs $20,000. So the total cost of her service in this example was $20,800. So what did Beth pay out of her own pocket? Because she utilized tier 1, she paid $15 for a primary care doctor, she paid $40 for a specialist, and to pay the rest. She was a smart shopper, so she said, you know what, I'm not paying my deductible for that lab work. I'm going to go to Quest. She went over to Quest, got the whole lab corp, and got the blood work done. She didn't pay a dime, and to pay the rest. For that surgery, the surgery was $20,000. Beth utilized tier 1 facility. Beth paid her deductible of $2,000 for surgery. Anthem paid the rest. Beth's total out of pocket for this case is $2,055. So that's one example.
And I can share with you, because Beth recently had this done, I actually paid more, because our current plan, I pay a little more than I would if
Yes,
I
you
had
do.
done it in July. So there you go. Yeah. Going to the whole side.
Yeah. So here's an example 2. So now I'm showing you Beth is now utilizing tier 2 facility. So same thing, PCP visit for back issues, $200. Now in a previous example, it cost $150, but I said we tiered the hospitals based on the cost and quality. So this facility in tier 2 is, you can see, charging more. Same thing for a specialist, lab work, surgery. Same thing. Now $21,000 was billed to Anthem. What did Beth pay? Beth paid $30 copayment for primary care doctor because she went to tier 2. She paid $40 for specialist. She paid $0 for labs because she utilized, one of those labs. And she paid $4,000 for a surgery because that's your tier 2 deductible. But then, after she paid her deductible, she was responsible for additional 20% co-insurance of remaining balance of $16,000, which adds up to $2,600. So when you add all this up, it's going to be more than this, right? 30, 40, 4,000 plus. So it's going to come up more than that. But you remember in the beginning when I said, once you meet that $6,600 in any plan year, everything else pays the rest. We pay the rest. So that's why if you add 26 plus 4 plus this would have been more. But we paid after that because
That's a really important point. That's your maximum exposure, the most that any one member would have to pay for the plan year. Once that's met, everything else is covered at 100%, regardless of whether you're going tier 1, tier 2.
yes. So click, please. Okay, so here's Bet's cost at glance. So tier 1 scenario, total cost $20,800. Bet paid that much. Bet satisfied with that payment, satisfied her deductible for tier 1. Tier 2, total cost, Bet's out-of-pocket cost. That's what Bet actually paid out of her pocket. With that payment, she satisfied annual limit. So now, same surgery could have been done between tier 1 and tier 2. Look at the cost, your out-of-pocket cost difference. So if you wanted to shop or wanted to go, you could have saved yourself a vacation.
Nice. And I also can share with you for myself, for this example, a lot of people say, oh, well, my surgeon is at such hospital or works here. The particular surgeon for this one has operating privileges at 2 places. So you might even have the same person working on you, but if they drive to that hospital that morning rather than that hospital, you have that flexibility too. So don't think, oh no, I have to go here. You might even be able to still have your doctor do the surgery at another place.
And I'm saying Bet still has the flexibility to utilize whichever provider she wants, but based on the cost, the smarter decision would have been not for everybody, but for her. Yes.
And so like her research for this would be to call Compass Smart Shopper.
Yeah,
in
she could have done.
advance
Yeah.
And plan it all out, right?
Yeah.
Okay.
Compass even calls you. You can call it on there. You can all kind of help you figure it out. And then you have a choice to do whatever you want. But most people would rather save in between.
So this is another example that we put together for you just so we can show it to you. So this is now Kathy, the other counterpart of Bet. The good one. I call her the bad one. She's the good one.
That's true.
She's my age, so I can call her that. So Kathy's utilizing tier 1. She goes to PCP. He charges Anthem $150. She goes to a specialist. The specialist charges $250. She has an X-ray of $450, and then she has an MRI after that. So total cost of service for Kathy was $2,850. So what did Kathy pay? So Kathy paid $15 for a PCP visit because she's utilizing tier 1. She paid $40 for a specialist visit. She didn't pay anything for X-ray because deductible was met on the MRI. So sometimes, and I'm not sure if you noticed this on your bills, you might think you went for a specialist first. I guess maybe that's not a good example. So in this example, for example, she had X-ray and MRI, and both of those things go against your deductible. But sometimes you look at your explanation of benefit and you see, how did my MRI hit my deductible first when I actually went to my MRI 2 weeks after? It all depends how your doctor bills. There are there are good offices out there, and I shouldn't say good, but there are offices out there that turn the bills right away, and if Anthem gets that bill first, we're going to process accordingly. There are some facilities out there that don't bill for 3 months. I guess they don't need that money.
Some longer.
So that's why I'm showing here, because this came in first, it took that deductible, and then when this came in, it paid at full because the deductible was met. So Kathy in this example paid $2,055. So the next example. So this example, she continues. She said, you know what? I'm going to stick with tier 1 because this is what I want. So now she has physical therapy. She has specialist follow-up visit. She needs some crutches for walking, and she also needs a follow-up MRI. So the total cost that was submitted to Anthem was $3,100. So what did she pay? So she paid $40 copay for a physical therapy visit. She paid $40 copay for a specialist visit. She didn't pay a dime for crutches because the deductible was met on that previous example. She didn't pay anything for the MRI because the deductible was met on that previous example. But this is where she could actually, so she only paid $80 out of her pocket, but she could have made money on this example. She called Compass in this case example and shopped for that MRI and decided to do what Compass advised her to do. She would have gotten $150 check back, which would have paid $80, and she would have been left with $70 to take her husband to dinner.
Nice dinner.
She
It's
could have
true.
taken Beth out to dinner.
Thank you.
So this is just an example to show you. Example number 3, she paid $2,055, satisfied her deductible, so no deductible exposure going forward. In example number 4, she only paid $80 for those office visits. She didn't pay any deductible because it was already satisfied. If Kathy chooses to continue utilizing Tier 1 hospital, her deductible for a plain year is satisfied and she will only continue to pay co-payments. Remember, you are the driver of your care. How do I save money? I think we hit all of these already. If you want, it's your choice. If you wanted to save money, utilize Tier 1 hospitals and primary care doctors. Make sure you're utilizing no-cost labs. That's the easiest way you can save money because almost everybody will have some kind of labs throughout the year. Even if it's a preventive lab, you're going to have it. Utilize urgent care or walk-in centers instead of the emergency rooms. Take advantage of mail order prescription program because you can save there as well. Use generic prescriptions when possible, but consult with your doctor because your doctor knows the best on that. Use the Compass Smart Shopper program to shop. Use Anthem Cost Estimator tool online to show you and estimate you the cost, and also use the 24-hour nurse line.
Melania, you know that in urgent care, some facilities have urgent care as a department within their facility.
Some of them, yes.
Is that considered urgent care at the 125, or is that considered a copay?
Ask this question about 2 minutes before
It's
we
a really
started.
good question.
That is really good questions. That's why I put in, we at Anthem have approved list of those urgent care facilities that we know will only charge $125, and that's what I put in the book. You'll see there's a list.
You know what page that's on?
Right here.
I'll let you.
It's page 23. So we keep the list because we know these particular ones will bill correctly and only apply that 125.
Mine got me an urgent care and they bill it as a PCP visit because I go there. So
Right.
that's their like, oh, you don't have a point for you today.
Right.
And that's good. Don't complain on that one.
It depends a ton on how they bill it and how they
Do better.
right?
Don't complain on that one. Just say, okay,
Yeah.
I'll pay
Yeah,
$15.
sure, yeah.
Oh, yeah.
So prescription drugs,
It's like, what is your
Yeah,
copay?
excuse
You say,
me.
yeah,
We got
$15.
prescription drugs didn't change a thing, so it's still 10, 30, 50. Like I said in the beginning, 20, 60, 50. So this is why I said utilize mail order. As you can see in this example, if you go month to month, so let's say 3 months you go, you're gonna pay 30. But if you do mail order for 90 days, you're only gonna pay 20. So you save some money.
And I think it's also, again, important to emphasize that these co-payments are now being applied to that maximum exposure that out-of-pocket tax.
Right.
Which is good.
So just Compass is there. We'll promote it throughout next year. So just keep an eye on that. That's it, I think. Utilize those no-cost labs as well as ambulatory surgical centers. I inserted the locations in the booklet, so it's right there. No, that's fine.
I want to know where this surgery center is on the top of the mountain. I'd like to go there.
You like that?
Yeah, it's nice.
And that's it. I think, do you guys have any questions?
I'm going to sign off of YouTube so you guys can ask me a bit more personal questions if that happens.
Want me to put the lights on?
Yeah.
I was just gonna make a comment.